And this is the thing. It is a matter of fact that we are not seeing excess mortality in our hospitals right now. We are seeing excess mortality on a low level in our homes, but these are patients, people who are under 60s, they're not dying of COVID, they're dying of untreated other diseases. We
That's
are
right.
not seeing body bags piled up in the streets, hospitals
Yeah.
totally over capacity. We are not
Yeah.
seeing, well, when you look at these infection rates from these tests that show us tens and tens of thousands of people every single day being infected with this terribly infectious, terribly deadly disease, we are not
Exactly.
seeing that played out in the hospitals. We're not seeing that in the mortality figures. It is simply there is simply no evidence that we are in a terrible, terrible second wave of this virus. When you look at, not a matter of opinion, but if you look at the simple matter of the data that is available,
Hmm.
official data from Public Health England, Office for National Statistics, and the NHS, there is no evidence that we are in a terrifying second wave of this virus, is there?
That's right. So I think I'm really glad you made that point because um, there's too much fear around, and let me just state some very basic facts. Just no spin here, nothing like the government, cherry picking data and exaggerating. I'll give you the absolute numbers today, and people can then take that away and make their own decisions about how scared to be. So, in terms of people actually infected today, it's probably around 1% in the population, but the vast majority of those will have no symptoms. And if you're under about 65, it's less risk to than regular flu. The number of people dying today is the same as it would be any other year in total. People are dying of respiratory diseases today. It's about the same as it normally would be. The thing is, they'd normally die of flu and pneumonia. Those diseases are very, very much reduced this year, and it's been replaced with COVID. The COVID deaths, just predicting from the charts and all the other considerations, will continue to go up from here. I actually agree with the government that it could approach the level of deaths per day that we had in the wave one. I don't think it will. I think it will top out at about two-thirds of that level in a couple of weeks' time. The hospitals, they've increased their capacity beyond normal years, so they are less full in emergency care units than they would normally be. So it's normally about 1995. They're about 85% this year. That's because they've increased the capacity, but they're in no way struggling to cope. So that's where we are. We need to predict where we go forward. Back to my crystal ball. And since the fact is that the prevalence of the virus in terms of people carrying it has plateaued and is now starting to at least run as a flat level. It looks like it may be going down as well. We can expect that to feed through in the health impacts, the death impacts over the next few weeks. That it will also plateau and then hopefully go down as well.
Yeah,
So it exists. It's real. We need to be careful, but we shouldn't be thinking of this as a major plague.
absolutely, again, absolutely, exactly. And this is not. No one sane thinks this is a hoax. It exists. It is real, and it is a
Exactly.
dangerous disease. It's about proportionality. I'd like to point out the French health minister yesterday said that France was now past their peak already. Pleasure to speak to you again. Just simple, bold facts, people. Professor Anthony Brooks, geneticist and health data scientist at the University of Leicester.